when you call, can you handle those objections? You will, and you can, because I'm giving you scripts. I'm giving you already the knowledge of what you're going to expect. You know you're going to get somebody telling you, I don't have time. You know you're going to get somebody that's going to tell you, we don't allow solicitation. You know you're going to get someone telling you that they're not here right now, leave your brochures. Do you know how to be able to respond to that? You have to understand, success is rewarded to you if you prepare. Success rewards preparation. You're not going to be successful unless you prepare yourself, unless you prepare your team. You have to understand, when was the last time that you practiced? When was the last time you actually was practicing how to make phone calls? I can guarantee you, when I ask this question, nobody can actually answer that. They will say, never. I never had, Michael. I thought about it. You know, I kind of imagined how this phone call was going to go with this physician or with this administrator. But did you actually come up with scenarios? Did you come up with a mastermind group? Did you actually bring a friend over and say, hey, I want you to sit here. I want you to say this. Give me an objection, and I'm going to answer to you right away. Can you answer really fast if I tell you I don't have any time? What's your answer? What are you going to tell the physician? You say, you introduce yourself to me right now. Pretend we're in the phone right now. Ring, ring. You say, hi, this is, Janet with ABC Home Health. I want to be able to speak to Dr. Patel. And I'm Dr. Patel, and I tell you, you know what? I'm busy right now. I don't have any time. Typically, people will answer, you know what, doctor? I apologize for taking your time. I'm really, really sorry. I'll call back later on. That's a typical answer of the average marketer, of the amateur marketers. I want you guys to become professionals at what you do, to become professional marketers instead. Have you ever hung up on yourself? Meaning that you were about to make that phone call, and the moment that the person answered, you just hung up on them? And, whether it's personal or whether it's business, because you didn't know what to say, you were lost for words, because you didn't prepare yourself. So it is important for preparation. Very important. Now, when you're cold calling, the first 15 seconds, your job is not to get them to hang up the phone. Because that first 15 seconds will determine is if you can go past that. If you can go past the first 15 seconds, then you did a great job. Okay? The second 15 seconds of it, so that's within 16 to 30 seconds of the call, is to get the intended target. You need to be able to qualify. Do you have the person in the phone right there and then? If that's not the person, stop presenting to them, because they're not the important person. The most important person is to go past them to the right person. So first 15 seconds, your job is not to get hung up on. Okay? Second 15 seconds is to get the intended target. Now, between 30 seconds to 3 minutes, you have a window to make a pitch and create value to why it is worth the time for you to give a presentation and give a pitch. That's your job. You have to get them to stay long. The longer you get them in the call, the longer you have chance to be able to have a presentation. So one of my first techniques that I do to try to challenge people to see if they're willing to take advantage of this is literally I tell them to go ahead and call someone. Pick up the white pages if you have one. And what I would say is this. Go ahead and call someone that you never met. Go call a business. Go call somebody that you don't know. And what you're going to do is you're going to ask for a movie recommendation. You're going to ask them to go ahead and recommend a movie that you should be watching. And if you can have a full-blown conversation with the person who you decided to call that you never met, and you can make it last for 3 minutes, I challenge you to do that for 10 calls. 10 straight successful calls that you can get the person to stay in the phone with you for 2.5 minutes. Now, a lot of people say, well, Michael, this doesn't really apply to us because, this is home health. This is home care. This is hospice, what we're trying to do. It's a challenge. If you can actually do this, then you can literally call anybody else. I've even used this techniques when I hire new marketers. I give them the phone and I say, all right, call. Or at times, the next level is, okay, here's the phone, go call this physician and set up an appointment. My goal is to literally see if they're willing to just grab the phone right there and then. Not worrying about the success or the failure. It's a matter of trying. If they hesitate, then I know that they're going to hesitate to do the real thing. If you can't even ask somebody for a phone number or for a recommendation for what type of movie to watch, you think you're going to be able to actually call someone and ask them to start referring patients to you? If the main person you want to speak to is not in, make sure you always gather information for a later call or for your cold walk-in. Typically, when we actually make cold calls and after the third cold call and we still do not get a response or get that person to at least say yes or no for a meeting, that's when we will do and assign that particular contact as a cold walk-in. Because by then you should already have the information on who works in his office, who his assistants are, what type of patients he's working with. By the third call, you should have a lot of information and written a lot of stuff in your black book about this particular contact. So this is the person that's going to deserve a walk-in from you. This is what we call the cold walk-in, where you have to go in and meet with this person and try to corner them and get the information that you want and try to get them to commit to actually start referring patients to you or to get them to commit to allow you to present to them. So those are very important. So let me go ahead and share with you guys additional more information.